Why come to Duke and why train here? I think there are a number of really good reasons. We'll start with the clinical. I think that clinically it's one of the better programs in the country. Our outcomes are excellent. We are challenged with many low birth weight babies, many sick full-term neonates, and our outcomes for chronic lung disease survival, necrotizing enterocolitis, chronic lung disease, bronchopulmonary dysplasia, and necrotizing enterocolitis are among the lowest in the country. And we benchmark this with our fellow programs in the NICHD Neonatal Research Network, as well as in Vaughan. So that, I think, is probably one of the more important reasons to consider Duke.
The strengths of the clinical training here are varied. We currently have certainly all the major subspecialties and support individuals needed to comprise the full training of a young fellow. We also have the ability to conduct extensive new clinical research. And the area of clinical research is very important to, we believe, to a young neonatologist in training, as they are going to be required as well as expected to develop the new therapies needed to advance our field. So the area of which Duke, I think, will do well for a young neonatologist will be to provide them with an environment in which they can not only explore their own interests, but also see where those interests will have to take them to become competent and effective neonatologists in the future.
So the clinical experience here at Duke is incredibly strong. We take care of very high acuity patients, both here inborn at Duke, as well as patients that come in from other area hospitals. What I particularly enjoy, though, about working in our unit is the team approach that we take. We have nurse practitioners that we work very closely with, of course, our residents and other trainees, and then we have pharmacists, nutritionists, and other people that join us in the day-to-day care of our patients. It's a really valuable experience working within that team.
I think we really have a very strong clinical program. We get exposed to newborns with every kind of imaginable ailment, both inborn and outborn, meaning that we're at the deliveries when things are in trouble. We're implementing all of the NRP, and then we get transfers in of the very sick babies from a wide regional area. And I think given the inborn-outborn exposure within a very large academic center, really the clinical experience here is top-notch.
So one of the advantages of the training program here is that we offer a neonatal palliative care program. This program started back in 2007, and it offers a different perspective to parents of babies who have life-threatening conditions. Some of these babies have the option to go home with their parents with hospice care, and we follow them even when they're home. And we follow some of these patients also in our clinic. We are in contact with them. At the same time, having a palliative care program offers some parents who have a prenatal diagnosis of a life-threatening condition in their babies the opportunity to come to Duke because of this palliative care program.
The thing that I have enjoyed most about my fellowship is the people. The people within the division are an amazingly supportive group and really care about us as a fellow and really treat us as colleagues. And so it's been just an amazing experience working with the folks here within the division. And then also not only the faculty in the division, but the fellows that I work with, my coworkers, are just an amazing group. We seem to really always get great people every year from diverse areas of the country and diverse backgrounds, which really adds to the mix of the people here. And so it's just been an amazing experience. Aside from the faculty and the fellows, the group of residents, the nurse practitioners, and the nurses that we work with within the unit are it's an amazing group. And I really enjoy coming to work every day, and I enjoy working with the people I work with, which makes working the long hours really enjoyable.
Duke is interested in attracting fellows that are not only going to be committed to being excellent caregivers and neonatologists, but people who are going to contribute to the field, who really see it as their mission to enlarge knowledge as well as be excellent clinicians. everybody who goes to a top-rated neonatology fellowship will come out at the other end and they'll be a good neonatologist, they'll be a good doctor. We like to do something extra. The extra that we like to do is to make them good scholars and good thinkers as well. And so the kind of person that we're interested in is curious. They're interested. They are really committed to understanding how to enlarge the field and do a better job and get new knowledge.
I would recommend Duke's neonatal fellowship program to people who are interested in the field because it really does an excellent job of combining both clinical training with research opportunity as well. You might go to a program that has excellent research opportunities but is really weak on their clinical training. And conversely, you might go to a strong clinical program, but the research opportunities are limited. And I really think that Duke has done an excellent job of combining both of those features into one program.
Because of the tremendous opportunities at Duke and the opportunities now in the Division of Neonatology and in our Neonatal-Perinatal Research Institute, we're able to offer a tremendous series of opportunities or possibilities for fellows that are willing to work hard and really seize the opportunity. I mean, they can just use us. Take what we have here as a tremendous amount of science, and whether you're a basic science person and or a clinical research person, an educator, an informatics person. There are places here at Duke that will allow you to reach your potential, and our hope is that the potential is to be an academician and an excellent clinician.